Hello and welcome once again to ECG interpretation. Today we are going to look at the heart rate. Now, when we say heart rate, we mean the number of times the heart beats in a minute. Now, how do we determine this heart rate? There are a lot of methods which we use to determine the heart rate, which we are going to look at today. But before we can even determine the heart rate, the first thing we must do is to look at the speed with which the ECG paper is running. And so in some areas, we have 25 millimeters per second being used as the standard speed with which the ECG paper runs. But in some areas also, we have 50 millimeters per second, which is used as the standard speed with which the ECG paper runs. And so if the speed is 25 millimeters per second, then a small box is going to give us 0.04 second and a large box is going to give us 0.20 seconds. Likewise, if the speed is 50 millimeters per second, then it will take 0.02 seconds for us to get one small box, and it will take 0.10 seconds for us to get one big box. I will explain more about this when we get forward. Now, we must also know that the heart rate may either be slow or fast. And so a heart rate less than 60 beats per minute is referred to as bradycardia, and a heart rate more than 100 beats per minute is referred to as tachycardia. And so, which are the methods that we use in determining the heart rate? Now, the first one we are going to talk about is the 300 rule, or the rule of 300. We usually use this when the rhythm is regular. And what do? We easily divide 300 by the number of large squares between two R waves. What do I mean by this? Now, if you recall in our introductory video to the ECG paper, I said that one small box takes 0.04 second for us to get one small box. And how do you even come by the 0.04? We said if the speed is 25 millimeters per second, and we know that from this end to that end is 1 millimeter, then we are going to divide 1 millimeter by 25 millimeters per second, and we are going to get 0.04 second. If the speed is 50 millimeters per second, then it means the ECG paper is running faster. And so we are going to divide 1 by 50 millimeters per second. We are going to get 0.02 seconds. Also, since we are having 5 small squares in one big box, we are going to multiply 5 by 0.04 if the speed is 25 meters per mercury to get 0.20 seconds. What it means is that we are going to spend 0.20 seconds for us to get one whole, large square. Now, how does this knowledge helps us to determine the heart rate? And even how do we even come by this 300? It's not so difficult. I'll explain to you. Now, we know that the heart rate is measured in beats per minute. And 60 seconds will give us 1 minute, right? So, if we are taking 0.2 seconds to get one large box, then in 1 second, we are going to get 5 big boxes. And since the ECG is, or the heart rate is measured in a minute, then in 60 seconds, we are going to get more boxes or more beats. So what we do is we multiply 5 by the number of times which the heart rate is being recorded, which is 1 minute. And so we are going to multiply 5 by 60 seconds to give us 300. And so if the speed is 25 millimeters per second, then the heart rate in beats per minute is going to be 300 divided by the number of boxes between the RR interval. And if the speed is 50 millimeters per second, it means It is double the rate at which the paper is running. And so instead of 300, we are going to have the heart rate in beats per minute to be 600 divided by the number of boxes between R and R interval. I'll give you a lot of examples so that this thing will make a lot of sense to you. Now let's look at this first example. In this ECG, when we look at the R interval, this is our first R and this is our second R. So we count the number of large boxes in between these two R's, and we are having 1, 2, 3, 4. So we are going to divide 300 by 4, and we are going to get 75 beats per minute as the heart rate, because this is a regular rhythm. In the second example, we have here to be our R, first R, and another R. So we count the number of boxes between these two R's, and we are getting 1, 2, 3, 4, 5, 6. And so we divide 300 by 6, which will give us, it's 300 by 6, not 300 by 60. So we divide 300 by 6, and we are going to get 50. It's supposed to be 300 by 6. Now, the 10-second rule is used when the rhythm is irregular. Now, before we even understand the 10-second rule, what we must remember is that on a 12-lead ECG, each lead is recorded for 2.5 seconds. And since there are 4 leads across the ECG paper, we are going to multiply 4 by 2.5 seconds, and we are going to get 10 seconds. That's how come we come by the 10 seconds rule. What it means is the whole rhythm strip, the whole ECG paper, is running for 10 seconds. Now, since we measure the heart rate in a minute, which is 60 seconds, then we must divide 10 seconds by 60 seconds, which will give us 6. And so in an irregular rhythm, the heart rate in beats per minute is going to be the number of beats, or the number of QRS complexes which appears across the ECG paper multiplied by 6. Let me give you an example to make this thing clear to you. Look at this ECG paper. This is standard lead 1. From the beginning of standard lead 1 to the end of standard lead 1 over here is recorded for 2.5 seconds. AVR starts from here and ends here for 2.5 seconds. Then V1 starts here up to here, also for 2.5 seconds. Then V4 ends here, which is also 2.5 seconds. And so this whole strip is 10 seconds. Now, for us to get the heart rate in a minute, then we have to count the number of beats, or the number of QRS complexes which is occurring throughout this whole 10-second strip. And so we can easily count it. Look, we count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 QRS complexes across this whole rhythm strip. You can count it on any of the leads and you are going to get 15. And so we multiply 15 by 6 to give us the heart rate that we require. In this example, we can count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. We are counting 13. I think I missed one. We can count 13 across the whole strip. So over here we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So we have 13 QRS complexes which appears throughout the 10-second strip. And so we multiply the 13 by 6 to give us 78 beats per minute as the heart rate in an irregular rhythm. Now, we also have what we call the 6-second rule. When we say this, what we mean is anytime you pick the ECG paper, it is marked by the first second. So you see a mark over here as the first second. Then we have also the 3rd second. Then we also have the 6-second marking over here. Now, you count the number of QRS complexes which occurs or which appears between the 6-second strip, then you multiply by 10. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we have 10 QRS complexes occurring in a 6-second strip, and so we multiply this by 10. You will get 100 beats per minute as the heart rate. In this second example, we have 5 QRS complexes occurring within the 6-second strip, and so we multiply 5 by 10 and we are going to get 50 beats per minute as the heart rate. Yet we have another method which we use in determining the heart rate, which is the rate determined chart. It's an already prepared chart which has all the heart rate on it, and so what we do is we find 2 R waves. So this is going to be our first R, and this is going to be our second R. So we count the small boxes which occur between these 2 R's, and so we have one big box here, another here, so we have 10 already. So 11, 12, so 13, 14, 15. So we have 15 small boxes occurring between these 2 R waves, and so we quickly go onto the rate determined chart and look for 15 spaces. So 15 is giving us a rate of 100 beats per minute. In our second example, we have how many small squares in between this R and R interval. We can count 6. So 1, 2, 3, 4, 5, 6, and so 6 by 5 is 30, and so we quickly go on to the rate determined chart and we are going to look for 30 spaces and we are going to have 50 beats per minute as our heart rate. So these are some of the methods which we use in determining the heart rate on an ECG. So what have we learned so far? We started with the rhythm of the ECG, and we said it can be regular or irregular, and it may be sinus or non-sinus. Sinus is when P wave precedes the QRS complex, and non-sinus is when we don't have any P wave preceding a QRS complex. And we also said we have the 300 rule, which we divide the 300 by the number of large squares between 2 R waves. Usually we use it for regular rhythms. And we have the 10-second as well as the 6-second rule, whereby we count the number of QRS complex which appear on the ECG strip. Then we multiply it by 6 and also by 10 respectively. Then finally, we can use our rate determining chart, whereby we count the number of small squares in an RR interval. Then we go to the chart and look for the heart rate over there. So these are the simple ways that we can calculate the heart rate and also determine the rhythm of an ECG. Thank you very much for your attention.